Welcome to History and Stories. Throughout the ages, humanity has faced many challenges, and few have tested our resilience as profoundly as pandemics. These invisible enemies, often arriving with terrifying swiftness, have left their mark on every corner of the globe, shaping civilizations and forever altering the course of history. From the bustling cities of antiquity to the interconnected world we know today, join me as we venture into the annals of history to uncover the stories of the deadliest pandemics. These are not just tales of suffering and loss, though those emotions are undeniably woven into the narrative. Instead, we will approach these historical events with a lens of learning, examining the profound lessons etched into each outbreak. By understanding the past, we can better equip ourselves to face the challenges of the present and the future. Our journey begins in the mid-14th century, a time when Europe, brimming with life and trade, was about to face its darkest hour. From the bustling merchant ships arriving at Sicilian ports in 1347, a silent predator emerged. The Black Death, a devastating strain of bubonic plague, had arrived. Spread by fleas carried on rodents, the plague moved with terrifying speed. Imagine, if you will, medieval cities, their streets teeming with people, suddenly falling eerily silent as the disease tightened its grip. Within a few short years, the Black Death had claimed the lives of nearly half of Europe's population. Entire villages were wiped out, leaving fields untended and homes abandoned. Mass graves became commonplace. Fear and paranoia gripped those who remained. Yet, amidst the despair, the Black Death also became a catalyst for change. The massive loss of life led to labor shortages, empowering the peasant class. This shift contributed to the decline of feudalism and a new social order. The Black Death spurred advancements in medicine and public health. Quarantine measures were implemented to contain the spread. These early efforts laid the groundwork for future public health practices. As we emerge from the shadow of the Black Death, we carry with us the stark reminder of our vulnerability. This pandemic underscores the delicate balance between humanity and disease. The year is 1918. The world, weary from the ravages of World War I, is caught in the grip of another global crisis, the Spanish flu. This deadly influenza pandemic, first identified in military camps, spread with astonishing speed, facilitated by the very movement of soldiers returning home from the war. Unlike the Black Death, which had primarily ravaged Europe centuries earlier, the Spanish flu was a truly global pandemic, reaching even the most remote corners of the world. The virus, highly contagious and particularly deadly in young adults, swept through communities, leaving a trail of devastation in its wake. Hospitals, overwhelmed by the sheer number of patients, were forced to turn away the sick. Makeshift infirmaries were set up in schools, churches, and even private homes, but resources were stretched thin. Doctors and nurses, working tirelessly around the clock, themselves succumbed to the illness, further compounding the crisis. The Spanish flu pandemic, in just over a year, claimed an estimated 50 to 100 million lives worldwide, surpassing the death toll of the war it followed. The impact on society was profound, leaving families shattered and economies crippled. The world was left reeling, grappling with the enormity of the loss and searching for answers. The Spanish flu pandemic exposed the critical need for global cooperation in the face of infectious diseases. It highlighted the importance of public health infrastructure, from surveillance systems to the development of vaccines and treatments. In the aftermath of the pandemic, significant advancements were made in virology and epidemiology. Scientists, driven by the urgency of preventing another such tragedy, made strides in understanding the influenza virus and developing vaccines. The lessons learned from the Spanish flu would shape public health policies for decades to come. As we reflect on the Spanish flu pandemic, we are reminded of the interconnectedness of our world and the shared responsibility we have to protect one another from the threat of infectious diseases. In the latter part of the 20th century, a new and insidious threat emerged: HIV/AIDS. First identified in the early 1980s, this devastating virus, which attacks the immune system, leaving the body vulnerable to opportunistic infections, sparked fear and uncertainty around the world. Unlike the pandemics of the past, which often spread rapidly and burned out relatively quickly, HIV/AIDS presented a different challenge. This virus, transmitted through bodily fluids, could remain dormant for years, silently spreading within populations before any symptoms appeared. The early years of the HIV/AIDS pandemic were marked by stigma and discrimination. The disease, initially associated with marginalized communities, was often misunderstood and feared. Misinformation and prejudice fueled the spread of the virus, hindering efforts to provide accurate information and care to those in need. However, amidst the fear and uncertainty, a global movement emerged. Scientists and researchers working tirelessly raced to understand the virus and develop effective treatments. Activists and advocates challenged stigma and discrimination, demanding access to care and resources for those affected. Over time, significant strides were made in the fight against HIV/AIDS. Antiretroviral therapy, a revolutionary treatment that suppresses the virus and allows people with HIV to live long and healthy lives, became more widely available. Public awareness campaigns helped to dispel myths and promote prevention strategies. While HIV/AIDS remains a global health issue, the progress made in prevention, treatment, and care has been remarkable. The pandemic serves as a potent reminder of the power of scientific advancement, the importance of addressing social determinants of health, and the enduring need for compassion and understanding in the face of adversity. Let us now journey back to the 6th century, to the Byzantine Empire, a civilization at its zenith. The year is 541 AD, and a new threat emerges from the bustling port of Pelusium in Egypt, the Plague of Justinian. Named after the reigning Byzantine emperor, Justinian I, this devastating pandemic, also a strain of bubonic plague, would leave an indelible mark on history. Imagine, if you will, the bustling streets of Constantinople, the empire's capital, a vibrant hub of trade and culture. Now picture those same streets, once teeming with life, now littered with the dead and dying. The plague, carried by rats aboard grain ships arriving from Egypt, had taken hold. The symptoms were agonizing: swollen lymph nodes, fever, chills, and ultimately, a gruesome death. The Byzantine Empire, already grappling with overexpansion and military conflicts, was ill-prepared for the onslaught of the plague. Hospitals overflowed, and the dead, overwhelming burial grounds were left to decay in the streets. Emperor Justinian himself fell ill, but, unlike countless of his subjects, managed to recover. However, his empire was forever changed. The plague of Justinian, raging for 2 centuries in waves, decimated the Byzantine population, weakening its defenses and contributing to its eventual decline. This pandemic, though occurring centuries before the Black Death, serves as a chilling reminder of the cyclical nature of infectious diseases. The plague of Justinian underscores the vulnerability of even the most powerful empires to the invisible threats that lurk at their edges. Though lost to the mists of time, the plague of Justinian holds valuable lessons for us today. It reminds us that pandemics are not merely historical events, but recurring challenges that demand our vigilance, preparedness, and understanding. And so we arrive at the 21st century, a time of unprecedented global interconnectedness. In late 2019, a novel coronavirus, SARS-CoV-2, emerged in Wuhan, China, rapidly spreading across borders and continents, ushering in the COVID-19 pandemic. This virus, highly transmissible through respiratory droplets, presented unique challenges. Its ability to spread asymptomatically made early detection and containment difficult. The world watched, with a mixture of apprehension and disbelief, as case numbers surged, overwhelming healthcare systems, and prompting lockdowns and travel restrictions on an unprecedented scale. The COVID-19 pandemic has been a stark reminder of our interconnectedness and shared vulnerability. It has exposed the inequalities in our healthcare systems, disproportionately impacting marginalized communities. The pandemic has also tested our resilience, forcing us to adapt to new ways of living, working, and interacting with one another. Yet, amidst the challenges, the COVID-19 pandemic has also sparked an unprecedented global scientific effort. Researchers around the world have collaborated at an unprecedented pace to understand the virus, develop diagnostic tools, and create effective vaccines. The rapid development and deployment of safe and effective vaccines have been a testament to human ingenuity and collaboration. The COVID-19 pandemic is still unfolding, and its long-term consequences are yet to be fully understood. However, one thing is certain: this pandemic will leave an enduring legacy on our world, shaping our societies, our economies, and our understanding of global health security for generations to come. As we've journeyed through history, witnessing the devastation of pandemics past and present, one resounding truth emerges. These events, as destructive as they are, also serve as powerful catalysts for change. They force us to confront our vulnerabilities, reevaluate our priorities, and innovate in the face of adversity. The lessons learned from the Black Death spurred advancements in public health and social structures. The Spanish flu underscored the importance of global cooperation and public health infrastructure. HIV/AIDS sparked a movement of scientific discovery, advocacy, and a fight against social stigma. And the COVID-19 pandemic, still unfolding, has highlighted the critical need for robust healthcare systems, scientific collaboration, and equitable access to healthcare for all. Thank you for joining me on this exploration of the deadliest pandemics in history. If you found this journey through time insightful, be sure to subscribe to History and Stories for more captivating tales from our past. Together, let us learn from history to build a healthier and more resilient future.